My first guests this evening are Retina Associates, Retina Specialist, Dr. Kitchens, Dr. Shirky, and Dr. Stone. Welcome.
Thanks
for coming in.
Thanks for letting us be here.
Dr. Stone, tell us about your group.
Well, we've been practicing in Central Kentucky for over 40 years, and our group specializes in the back of the eye, the retina. And what we do is when people have medical conditions that interfere with their vision, things beyond glasses and contact lenses, we address those problems. And our main offices are in Lexington, Louisville, and in Ashland, Kentucky, but we have satellites all over the eastern half of the state.
I'm surprised you do cover a lot of the area, because sometimes people with common diseases don't like to travel. And Dr. Shirky, tell us about, we hear about retinal detachment, but there's all kinds of common diseases, well, not common, with the retina that you treat.
Right, there's a lot of eye diseases that can cause vision loss, and in Kentucky, macular degeneration and diabetic retinopathy are two of the top conditions that we can successfully treat with medicine. We also are very interested in surgery, retinal detachments, macular hole work, epiretinal membranes, and even floaters these days.
Now, Dr. Kitchens, she mentioned some common things, we'll come back to them, but there's a whole bunch of new stuff about the retina going on.
Yeah, Dr. Fox, I tell you, one of the things that I love about our practice is that we are so invested in technology. If you look across the board, we're among the top probably 10 practices in the United States that do retina, and I'm proud to say that. And one of the things that separates us from everybody else is the fact that we invest in that technology. We have two pieces of technology that are revolutionary. One, in fact, that we were the first to innovate on, and one that we were the first private practice in the world to actually have it.
Well, you mentioned, I heard you talking off the air about 3D. It's like playing a video game?
Yeah, so one of the great new technologies that we have for surgery actually is we no longer look through a microscope to do surgery. We actually are able to look through a 3D camera with a heads-up display and a giant monitor. You can see some video footage here of us actually doing that. And this is now how we do surgery. And it has revolutionized how we take care of patients with diabetic tractional retinal detachments and retinal detachments as well.
Well, that's great information. You mentioned diabetics, and Dr. Shirky, you talked about it a little bit. We are forever trying to get our diabetics see the retina specialist once a year. You got to do it. What do you do with diabetic retinopathy?
Well, I think that getting that annual exam is the most important thing. If in any of the eye specialists can do that for you. If they see something, then they'll send those patients that have problems to us, the retina specialist. And if there's macular edema, we've got great medical treatments with intravitreal injections that we can give to help the vision improve again. If there's attraction detachments or bleeding in the center of the eye or a vitreous hemorrhage, we can use surgery to clear the view again. So we do have some really promising medical and surgical treatments for these diabetic patients.
Well, how do you know when you really need to see a retinal specialist? I mean, when I see some patients and I think, oh, this is a retinal detachment, I know to send them directly to you. Or the ophthalmologist use you as a referral source. Or there's something that a patient says, uh-oh, this is a real problem, I need to get it taken care of. Or there's some symptoms they should watch for.
Yes, blurriness, any loss of vision. And sometimes you can just say, well, I'm a little blurry, maybe I just need to get my glasses changed. But you should take that seriously. Maybe it's not your glasses. Maybe it is something even more significant than that. So the big thing is not to wait around, to seek medical attention if you are having any blurred vision.
Okay. Now, those are serious events, but there's a term we call floaters, Dr. Stone,
yes.
and sometimes I tell people it comes and goes, it's not a problem, but you can actually do something about them or not?
Yeah, there is something we can do about it, and it didn't used to be the case. I mean, as Dr. Shirky mentioned, there are things we see every day that can cause blindness that we can fix, and we couldn't do that 20 years ago in some of these diseases. But sometimes it's problems with your vision and symptoms that are so bothersome that they really affect your quality of life, and floaters is one of those things. And back in the day, we couldn't really do much. The surgery was maybe a little risky, but now we can do surgical intervention for these patients, and we can remove the floaters, and it's very similar to something like a cataract surgery that many of our patients have already had. and it's outpatient surgery, and we remove the floaters, and they're permanently gone, and it really leads to some very happy patients.
So some people who are really having a problem with it, it's not something they have to ignore. You can really do something about it.
You can. Most people who have them, they can ignore them. They don't bother them that much. But a subset of folks, it just drives them crazy. And then we get those out of there, and they're so happy.
Well, Dr. Kitchen, we saw some video of the new stuff that you were doing. But these patients tell me what you do there. I think, oh, that's got to hurt, or that's got to aggravate. Is it something that's cumbersome to the patient?
I'll tell you, in the clinic, we do a lot of injections in the eye of medicines that actually can treat, as Dr. Shirky had said, wet macular degeneration and diabetic retinopathy, and we do a great job of numbing those patients up. And it's amazing to find that these patients tolerate this incredibly well. With surgery, we do a very good job of doing a minimally invasive peribulbar or block where we inject around the eye while the patient's asleep, and they really don't feel anything. It's absolutely amazing, and most of our patients say, it's over. I can't believe it's done.
You mentioned some diseases. Are the risk factors for retinal tears, macular degeneration? I mean, are there things that, hey, that my parents had this, do I need to pay attention to it?
Oh, yes. Macular degeneration absolutely runs in families. And so if you have people that are kin to you that have had macular degeneration, it's really important for you to go, even in your early 40s or 50s, to get an eye examination to see if you're going to be prone to that. And certainly we tell everyone not to smoke. That's the biggest risk for creating vision loss with macular degeneration. So I bet you tell people not to smoke all the time, Dr. Fox,
yeah,
but we do
all
too.
the time.
Yeah.
Well, that's great information. We appreciate you coming in. You do great work, and it's really interesting. Thank you all. Appreciate it.
Thank you so much.